Cabinet Secretary, and I would like to add my thanks to Dr Atherton for his second annual report as Chief Medical Officer. I'm pleased that Dr Atherton has opted to use his annual reports to shine a spotlight on growing public health challenges. Last year, he singled out the health inequalities that exist between those living in our most and least deprived areas, and this year he has focused on gambling. When you consider the major public health challenges facing our nation, such as obesity and drug, alcohol and tobacco addiction, these are well known and well understood. Problem gambling, or rather the public health implications of problem gambling, aren't as well understood. Whilst there have always been problem gamblers, we are starting to see them in greater numbers. It is therefore welcome that Dr Atherton has drawn attention to this issue now. In 2005, the Labour government, under Tony Blair's stewardship, undertook the biggest deregulation of gambling our nation has seen. This led to an explosion in online betting. With TV ads for gambling now permitted, you can't escape prime-time adverts for online casinos and bingo. It is now much easier than ever before for young people to gamble. A recent Gambling Commission survey found an increase in students who gamble, with 2 out of 3 gambling, many online. This finding led to the Gambling Commission to produce advice to universities, encouraging them to provide information and support about potential gambling-related harm to the students, much as they do for drugs, alcohol and safer sex. As Dr Atherton highlights, 1.5 million of us gambled in the past 12 months. Whilst there is nothing wrong with the occasional flutter on the Grand National or buying a lottery ticket once in a while, the sheer ease of access makes it easier for gambling to become problem gambling. I welcome Dr Atherton's recommendations for the need to conduct further research. We need to fully understand the risks and the harms and develop evidence-based policy that balances the social benefits of gambling against the harms related to problem gambling. Cabinet Secretary, could you outline what action you are taking to implement Dr Atherton's recommendation for further research into the impact of problem gambling? And how do you intend to balance the need to take action to target problem gambling without impacting on adults' ability to gamble responsibly? And finally, Cabinet Secretary, how will you involve the Assembly in the development of evidence-based policy approach on tackling problem gambling? Thank you once again for your statement, and to Dr Atherton for his latest report. I look forward to working with you to develop a balanced approach to this and other emerging public health issues. Diolch yn fawr. Thank you.
Thank you for the comments and questions. On the overall point of the liberalisation of gambling, that's something that we've all recognised, that actually the growth in online gambling in particular is causing real challenges for us. And for all the exhortation about encouraging people to be responsible gamblers and encouraging the industry to be more responsible, actually, it hasn't led to the sort of shifts in behaviour that we'd want to see. And that's why I think even within the UK government that instinctively wants to encourage people to act in industry as opposed to having, if you like, a regulatory approach. I think they're shifting their own view. Certainly on the fixed odds betting terminal issue is a good example of whether they are now consulting and actually regulating a very different approach, because they recognise the harm that's being done on this is a completely liberalised area with a very significant harm that can be done in a very quick period of time. And so there is some awareness, but we will need to think about how we can actually use our powers here in Wales. And that's why, as indicated earlier, the Chief Medical Officer is leading work with stakeholders to look at what we can do, what we should do, both in the here and now, and also looking ahead to the powers that we'll acquire in April of this year. And indeed, you've heard in the statement and the questions already today the research Jane Hutt referred to that Citizen Advice are doing in Cardiff and Vale. There's a range of other people who are undertaking their own research, anecdotally more generally, about the problems they're seeing come through their doors. Some of those are mentioned in the report as well, in addition to the research that was undertaken by 5 members in this place, group together. Jane Hutt, one of them, Mick Anthony and Jane Brandt, the 3 that are in the chamber now. And that research matters about highlighting the challenge that we have, the scale of it, and the need for not just a policy response, but a practical one too. So, as I've said on a number of occasions, I expect to come back to this place to update members on the work of that group and the concrete action we expect to be able to take here in Wales.